In this video, we'll be exploring the surface anatomy and ultrasound images of the wrist, hand and posterior forearm. To begin with, we'll be looking at the surface anatomy of the palmar surface of the hand. The skin on the palm is thick and richly supplied with sweat glands. Remember, there are no hair follicles or sebaceous glands in this area. There are two prominences on the palmar surface of the hand formed by muscles. The thenar eminence, at the base of the thumb, is formed by the abductor pollicis brevis, flexor pollicis brevis and opponens pollicis. The hypothenar eminence is formed by the muscle bulk of abductor digiti minimi, flexor digiti minimi brevis and opponens digiti minimi. Distal to these, in the centre of the palm, you should be able to palpate the flexor tendons which travel towards the fingers. These are easier to palpate with the MCP joints flexed. With the wrist extended, we can emphasise some of the bones at the base of the wrist, which we can now look at closely. You should be able to palpate the pisiform bone on the anterior medial aspect of the base of the hand. This bone lies within the tendon of the flexor carpi ulnaris. Be careful not to confuse this with the hook of the hamate bone, which is slightly more lateral and distal, but in very close proximity. You may want to refer back to an image of the carpal bones to appreciate their respective anatomical locations. At the base of the thumb, you can feel the tubercles of the trapezium and scaphoid bones. We have now turned the hand over so that we can look at surface anatomy of the dorsal surface. We will pay particular attention to the anatomical snuff box. The lumbricals and interosseous muscles are more difficult to palpate. However, with the first finger abducted, it is easy enough to palpate and visualise the first dorsal interosseous. Extend the thumb and identify the borders of the anatomical snuff box. Laterally are the tendons of abductor pollicis longus and extensor pollicis brevis. Medially is the tendon of extensor pollicis longus. The proximal border is formed by the radial styloid process. You can palpate the radial artery within this snuff box. At the floor of the triangle is the scaphoid and trapezium carpal bones. Finally, when flexing the elbow under some resistance, the brachioradialis can be easily seen and palpated. This muscle originates on the lateral supracondylar ridge of the humerus and inserts onto the distal radius. This muscle forms the lateral border of the antecubital fossa. We'll now be using ultrasound to look at the wrist, hand and forearm. To begin with, we'll place the probe at the base of the wrist. At the level of the distal crease of the wrist, the carpal bones can be visualised, as can the tendons of the carpal tunnel. Deep to the carpal tunnel, it's possible to see the curved anterior surface of the lunate bone, which is visible as a white curved line. There are 9 tendons that sit within the carpal tunnel. These are 4 tendons of the flexor digitorum superficialis, one for each finger, which insert onto the middle phalanges. As expected, these tendons will lie more superficially within the carpal tunnel. There are also 4 tendons of the flexor digitorum profundus, which insert onto the distal phalanges and can be found deep within the carpal tunnel. Finally, the tendon of flexor pollicis longus can be found laterally and lies deep within the row of tendons. This tendon can be visualised by asking the patient to move their thumb. We'll now move the probe to the centre of the palm. In this view, we can see the superficial lumbrical muscles, with the flexor digitorum superficialis and flexor digitorum profundus tendons in between. Deeper, we can see the metacarpal bones and the palmar and dorsal interossei muscles. We'll now move the probe to the centre of one of the fingers. In this position, we can see the proximal interphalangeal joint, and as we move more distally along the phalange, this is the middle phalanx, we can then see the distal interphalangeal joint, and finally at the end of the finger, the nail bed is visible. Finally, we'll put the probe on the lateral epicondyle at the elbow. In this sagittal view, we can see the lateral epicondyle, and above it you can see the common extensor origin with lots of layers of fibres of the extensor muscles. Adjacent to the lateral epicondyle of the humerus, you can also see the outline of the radial head. If we move the probe into the transverse plane and down the posterior side of the patient's forearm, we can see clearly coming into view the supinator muscle. This becomes more apparent if we ask the patient to pronate and supinate their hand. And you can see it wrapped around the outline of the radius. In this video, we looked at surface anatomy and ultrasound of the wrist, hand and posterior forearm. Thank you for watching.